Hi, everyone. Welcome to the HSVMA Continuing Education webinar series. Thank you so much for joining us this evening. I'm Dr. Lorna Grandi, and I'm the Program Director of Education and Outreach for HSVMA, and I help to produce this CE webinar series, and I'll be your moderator this evening. So I'd like to give you a little introduction to HSVMA. The Humane Society Veterinary Medical Alliance is a national association for veterinarians and veterinary technicians founded in 2008. Our focus is on animal health and welfare. HSVMA provides a forum for veterinary professionals to educate, advocate, and serve. And these are some photos from some of our programs. An example of our advocacy work is that we engage veterinary professionals to advocate for the advancement of animal welfare legislation at the local, state, and federal level. HSVMA supports veterinary technician and veterinary students throughout activities throughout the country at veterinary schools and tech schools. And we offer continuing education such as this online webinar series and also in person. We partner with a number of HSUS programs and so that people can get CE if you want to do some service programs. So contact us if you're interested in doing any of that sort of thing. So I'd like to welcome tonight's speakers. Dr. Tamara Grubb is a diplomat of the American College of Veterinary Anesthesia and Analgesia with a strong focus in pain management. She owns Vet ACE, an anesthesia and analgesia and continuing education consulting practice with both small and large animals. Dr. Grubb is a national, international educator and lecturer, a certified acupuncturist, an adjunct professor of anesthesia and analgesia and the president of the International Academy of Veterinary Academy of Pain Management. In 2022, the World Small Animal Veterinary Association named her Speaker of the Year. Our speakers after Dr. Grubb are Jim Nelson and Rene Agredano. Jim and Rene are the founders of Tripawds.com, an online resource center for guardians of amputee pets to find free guidance and emotional support when their animal experiences limb loss due to cancer, trauma, or congenital reasons. The Tripawds community was founded in 2006 when their dog Jerry lost a leg to osteosarcoma and went on to live 2 remarkable years on 3 legs. In 2014, they formed the nonprofit Tripawds Foundation to help pet parents with direct assistance programs that help defray some of the costs associated with a pet's amputation. And as the caretaker guardian of a tripod dog, that's how I found Tripawds, which is how I also found Dr. Grubb. So I'm thrilled to have brought all these people together. We were able to bring all these people together and talk tonight about Tripawds. So please take it away, Dr. Grubb. Welcome.
Really appreciate the introduction and very much appreciate HSVMA for bringing us together, Dr. Grandi for putting this together and for hosting us. It's an amazing topic for all of us. Again, thanks. So many people have joined us. Very exciting. And Rene and Jim and I have spoken before, and we're really excited to be speaking together again. This is such an important topic. And we've called it Circle of Care. You'll see why, because it has to be a circle of care to support these amputees. And we have the care solutions, like what we're going to do as the veterinarians and veterinary technicians in the hospital. But the home recovery insights, let me just tell you, are insights. I really had no idea all that happens at home once we send these amputees home until A, I had my own. And you'll see her picture. And then B, when I met Tripawds and really learned, and to hear people's personal stories, you're going to hear some stories that make me go, oh my gosh, as a veterinarian, I need to learn to communicate better on this topic. So as this, of course, is our, well, let's see if I can change my slide. Off we go. Our motivation, again, all of us working with Tripawds or having our own Tripawds, we know how special they are. And our circle of care starts with pet parent or caregiver, and then of course includes the veterinarian, but also includes this village of people like the Tripod group to really help the pet parents and the amputee live their best quality of life. And so I'm going to stay in my lane and just talk about the veterinary part because, again, Jim and Rene have taught me so much about the rest of it. So let's start here. I want to start right away. And that dog on the screen there, that is my tripod, Lacey, that we had her for 1 year and 7 months after amputation. So she did great. And I want to point out some things about her in a little bit. But what are some of the sites of pain? And pick everything that you think applies. And these are potential sources of pain. It doesn't mean that they're going to occur. All of these would occur in every tripod, but could all of them? Could some of them? What do you think? So surgical site or incision pain, neuromas, peripheral and central sensitization, neuropathic pain, maybe trigger points or other areas of musculoskeletal inflammation or reactivity. So just looking at that tripod and thinking about everything that might be going on with them. And the reason I'm starting here, as you're thinking, is because my mission really is to make all of us understand how bad the pain can be for these pets so that we provide a robust analgesic protocol. And so let's dig into that a little bit deeper. And we'll start with the surgical side. Okay, we're about to learn a lot more from Jim and Rene. So I am going to stop sharing here so they can share and come in with their circle of care.
And I was just thanking you so much because you've said it all, but we are going to repeat some things. And these are things that are really important that need to be here. And we might have something additional that you need to know about tripods and what we're doing and how we can help your patients that are going through amputation. So thanks again. It's an honor to be here. My name's Jim Nelson, and I'm the man behind the curtain at Tripawds.
And I'm Rene Agredano, the other person behind the curtain at Tripawds.
We say that because it's really our community that makes the resource as good as it is, and we just keep things working. And I say resources because we have tripawds.com and tripawds.org, and I'm going to explain the difference about that real quick.
So the reason we started Tripawds is because of this dog, Jerry, that you see in the corner of your screen. Jerry lost a leg to osteosarcoma way back in 2006. It was the dark ages of the internet. And when we went looking for support, we found none. And we found very little information that was geared towards the pet parent. So we felt really scared and alone. And we thought we had the only 3-legged dog in the world with bone cancer. So we started this little blog named Tripawds. And it has since grown exponentially since then, as you're about to learn. And over the years, we've had other tripods. We had Wyatt, who you see there on the bottom corner of your screen. Wyatt was a rear-legged amputee. And now we have Nellie. And Nellie is a 3.5-legged honorary tripod who has a carpal flexion contracture, so she can't use one of her legs.
And we're not here by any means to replace veterinary expertise. We're more here to serve as an emotional bridge between you and your clients and help prepare them. And we're going to go over a lot of ways we do that, but there's no need to take a bunch of notes because we have a nifty checklist we want you to check out. We're going to send that to you at the end. So how do we help vets?
So like Jim said, we are not vets, but we go out there and we search for credible information to provide to pet parents, vetted information from experts, because this is something that social media rarely does. We know your time is limited at discharge and things are crazy at the clinic. So we want to save you time spent with those emotional concerns that pet parents like us have. And in the end, we really want to reduce the phone calls that your team gets at the front office, because these questions are things that people ask all the time in Tripawds, thousands of times.
And this works with clients who have found our resources and not just trusted Dr. Google, because we help them learn what to expect regarding recovery. And our support tends to lead to a safer recovery and a happier life on 3 legs. And we're going to share how we do that. But first, I have a quick poll too. Over the years, we've had a survey or two, and we're going to see a poll real quick here with this question. What percentage of pet parents say they would proceed with an amputation again, having gone through this before? So you see a number of percentages there. We hope you'll pick the one that we're going to share with you.
And over the years, we've done a quality of life survey every couple of years, and it's modeled after a really well-known 1999 study done by Dutch veterinarians who asked pet parents, would they do this again, knowing what they know now? And the results are really surprising.
But here's the truth.
See that green bar over on the left of the slide? That tells us that 98% of pet parents say that they would do amputation again if they had to. Most people don't regret the decision to amputate, even when their time is short with their dog or their cat. And we feel like this is because of the support they get from one another in the Tripawds community.
Again, it's purely anecdotal. It's no scientific survey, but it's because they found our resources and we've helped prepare them, and they've seen other people learn what to expect through what we offer at tripawds.com. We have free resources, including popular discussion forums, a live chat. We actually host more than 2,000 three-legged dog and cat blogs for people so they can see stories and photos and videos all over the map, from pugs to Great Danes. We have weekly, monthly support calls and photo galleries. And then over at tripawds.org, I explained there's a difference. At tripawds.org, we offer direct financial assistance programs. We help families in need help pay for amputation surgery, and we offer free reimbursement to anyone who takes their three-legged animal for rehab. We have a toll-free helpline where we'll answer the call and say, we're not a vet, just hope it's not an emergency, but we'll give you that shoulder to cry on.
And you put this all together and it really creates a sense of community and confidence. People just know they're not alone in this ordeal.
So how do we help in particular certain people?
You know, like Dr. Grubb was saying, you guys see this all the time. You really know that in most cases, the animal is going to do just fine. They're going to recover and go on and be happy. But pet parents like us, we don't believe you because we usually haven't been through this before. We've never been through a major surgery with our pet. We've never seen our pet on pain medication like this. So it's hard. And Jim's about to show you something that will...
It is hard. And I have one particular example, but I want you to know that this is just one case. We don't see this all the time. It's one case, one certain clinic, and one particular case. And we don't see it all the time, but it is an example of what can go wrong when there is a lack of communication. It's only about a minute long.
Every obstacle that could be thrown at a person during recovery happened to you guys.
Yep.
So...
Well, it was like every vet and surgeon and oncologist, and we had such a small period of time to prepare for the surgery, talk to as many people as we could in that time, and everybody was just so casually like,
won't even notice, bounce right back.
They bounce right back, you know, 3 legs and a spare, which is true, but it's instantaneous. They'll just be fine. They figure it out on their own. You don't have to do anything. We were just given zero guidance. So we were never told anything about physical therapy. In fact, we actually asked and were told, no, you don't need that. You put us in touch. You helped us find AMC, the rehab department at AMC, which was life-changing for us. I had about 15 tabs open on different pages of your website, different information. And one of them was just a photo gallery of what the recovery wound looks like. So you can prepare yourself before the surgery. And I was like, that is something that I really could have used. I didn't know it was going to be unbandaged. I had no idea how traumatic just what it visually would look like.
We didn't realize, Genevieve kept saying she didn't realize it was going to be like Civil War battle.
Yeah, we picked her up and she looked like a Civil War amputee. Like
oh,
the swelling and the bruising, it was terrifying.
So that is just one case, but it really is terrifying when you've never dealt with this before.
Clear communication is just so important. And it starts with giving people a realistic recovery picture. You won't scare them, I promise. So we have created a checklist for you. You're going to get after the presentation. Don't worry about taking notes. It's a little overwhelming, but we got you covered.
The clients need to hear more than your dog will be fine. I cringe every time a new member comes with they said their vet said, oh, just let your dog be a dog. They need more than just some discharge instructions they may or not read and a bag of pain meds. And there are many ways that you can help your clients be ready for anything. So we're going to start by addressing a few of the most common concerns we've seen about help reduce anxiety before, during, and after surgery over the years. So
guess what the number one concern is? Pain medication and side effects. Please review the pain medications in a way that explains that there can be variation in how their animal is going to respond to the pain control. Because a lot of pet parents like us think we give them the pain meds as instructed and they're going to do exactly what they're supposed to do. We don't know that's not always the case. So remind people that those medications may need fine tuning and not to be afraid to call the clinic if they suspect anything needs to be changed. and not to change anything until they talk to you. We see that all the time.
One really important thing that I wanted to know that I hope other people in our community ask about their vets is the difference between pain medication side effects and certain pain signals, because we know there's an overlap there, but we really need to know what to look out for and how to tell when there's either too much or not enough medication, and what to do if they suspect if their pet is in pain. I also suggest that we please address certain things that might not be at the top of your mind, like lack of appetite and constipation due to certain pain meds and what you can do about that.
So our next concern has to do with the incision and wound care. So prepare them before surgery. Show them what the incision is going to look like, how big it's going to be, where it's going to be. Give them photos, and if you don't have any, we have tons in our gallery. Also let them know there's going to be bruising. People flip out with bruising. It's scary. Let them know that it's going to be worse before it gets better.
So it is scary. And you heard Genevieve there. She was traumatized by the sight of the incision. Some vets choose to use compression bandages, others don't. So before they come to pick up their animal, please let them know if it's going to be bandaged or not and why. And when it comes to wound care, please address topicals, because we cringe again when people come to us saying, oh, I read on Facebook you should smear honey on it. Or, oh, Neosporin, you have to use that. Or massage the area directly. These things, if you have any specific wound care tips, please make sure they understand those things. And really, when it comes to amputation, talk about seromas. I didn't know what one was, and a lot of our members don't. Talk about the ability or the possibility of fluid buildup, whether or not you're going to be inserting a drain or how it can easily be drained like we had with Jerry, and especially what to do when what I call a seroma goes bad. Look out for smells, discharges, that sort of thing.
Okay, our next concern is mobility challenges. Let people know that they need to keep their expectations in check. We all have high hopes that our animal's going to just bounce back, but you know this, all dogs and cats have different reasons for amputation surgery, and all recovery timelines are going to be different. Everybody's going to be different. So remind people of that. They think their dog's going to be just like the one they saw on Facebook running around 3 days later. Also let them know that a little tough love goes a long way. There's a fine line there between hand feeding your dog every day for 2 weeks, like Jim is doing there.
Guilty.
Or, you really have to encourage the animal to get things on their own after a while. That if you don't, it just delays recovery.
The vet that gave us that tough love advice also said, focus on healing the body first. And she also said, just because a tripod can do everything a four-legger can do, doesn't mean they should. So it's really important to let your clients know not to compare. When they arrive at home with that bag of meds and they sit down and they start Googling things, they see things on Facebook like other dogs running around, and they think, oh, my dog can do that too. So please stress the importance of not comparing your dog, because every case is different.
Also, let's talk about rest. Just really, really encourage people to allow even younger animals to have that time to heal, and just minimal activity. Enjoy the couch time watching Netflix during those 2 weeks of recovery, minimum 2 weeks.
The best way to do this, I think, is to provide some activity guidelines. Like maybe they should only be doing short leashed potty walk time until those stitches are out. And after that, give a reference point. Instead of like talking about how far they should walk, give a number of minutes, because we're aware that shorter, more frequent walks are better for a dog that is adjusting to their new gait and stance. And then if there's kids or other pets in the household, be sure to clarify when it will be safe to go back and start playing with other pets, or might want to delay the dog park activity.
So let's talk about assistance devices and home modifications. We call this the new normal, and these are just things that we would do for a senior pet, only we're doing them sooner now that we have a tripod. So encourage your clients to go home and get something like a brain game for their recovering tripod. That's going to work their mind instead of their body. We want them to have traction on their floors. I don't care how pretty they are. Go get the no-slip rugs and put them down, even for cats. Litter box modifications for cats too. Speaking of cats, low-sided litter boxes are a tripod kittie's best friend.
Some of the best advice I heard regarding this was to create a safe space to recover, as if you would in the clinic. So use devices to create a recovery room per se. You can use X-pens to make sure the pets don't jump up on furniture and run around the house, but still be with you, and use baby gates to keep them off of out of places they shouldn't be or off of stairs. And then as healing goes on, be sure to mention things like helpful harnesses that can help a dog in and out of vehicles and up and down stairs without the increased impact on that remaining limb, or strollers, which can help dogs get out and about on longer walks, especially if there are other dogs in the household. And especially prosthetics. So like Boris there was a perfect example of how a prosthetic can work well. That's because they discussed it before surgery. All too often we get that question every time, what about prosthetics? And we hear about it after surgery. And we know that the best adapted prosthetics usually require an articulating appendage of some sort, remaining limb. So if prosthetics is going to be discussed, please talk about it before the surgery occurs. Finally.
Rehab. We say that a lot at Tripawds, and a lot of what we just explained, we learned through rehab therapists. Many new Tripawds come back to us weeks, months, maybe even a year later with a major injury because their pet parent did not know what was safe and appropriate activity for their animal. Rehab can inform them what their cat or dog should and shouldn't be doing, and it really helps with a safer recovery and a happier life on 3 legs.
And we know every case is different. That's why we are real strongly on suggesting going to rehab with your pet, because what experience with your dog is different than others. And we believe in this so much that our Tripawds Foundation will pay for that first visit. Anyone who takes a 3-legged dog or cat to a certified rehab therapist for consultation about weight management and exercises they can do to help their animal, we'll pay up to $200, which usually covers the first visit. We also will help them find a clinic near them if they can't find one. And we have free brochures available to help your clients find all these resources and take advantage of these assistance programs. So
we know this is a ton of information. I'm sorry if we overwhelmed you, but you're going to get all of this in a checklist. And in the clinic, we know your time is short. So by sharing these checklists with your clients, we hope it makes your job easier and more fun as you watch their anxiety level go down and the happiness and comfort of their pet go up as they learn to live life on 3 legs. Can't thank you enough for being here.
And we hope our materials will help with that. The checklist will be sent out after the webinar, and it's a simple thing that you can sit down and kind of go through with the patient or the client during discharge, or hand to them and have a checklist that they can refer to that makes sure they have all their questions answered. And of course, we also have the brochures available that you can get and stick it in that bag of meds with those discharge instructions when they leave. And it's really an honor to be here. I really appreciate any questions you might have, as long as they're not of a technical or clinical nature.
Thank you.
Thank you, you guys. That was really fantastic. A lot of really amazing information. And we have, Dr. Grubb, we have several questions for you, and we have a few comments for Jim and Rene. Larry says, kudos to your support group, and that's probably why you got that 98% statistic, because of the support that you guys give. And other people commenting about how really helpful so much of this information is. So more are coming in. More questions are coming in. I'll try to get to as many of them as I can.